Dr. Quinn, regular doctor visits a fact of life for many of us, especially as we get older. Can we expect the same quality of care through telemedicine?
Well, the deal is telemedicine is very effective. I honestly just started about a week ago. I've been contemplating starting a telemedicine practice as an adjunct to seeing patients in the clinic. But hey, when the coronavirus crisis presented itself, we had to come up with alternative means to care for our patients. And so far, telemedicine has been great, although there are some limitations. But very interestingly, some of the home health care agencies are stepping in. I've had encounters where I have patients that I have on home health care, and the home health care agent will actually go to the home and check the blood pressure and do the lab work. And those same individuals, especially my elderly patients, are spared coming to the doctor's office, potentially exposing themselves and contracting this coronavirus, which can be deadly for that population.
Now, Dr. Quinn, allergy season is in full bloom. What happens when a doctor can't look in your ears or down your throat to diagnose a problem?
Well, what we have to do in that case, and what we're doing, is we're relying on our diagnostic skills that we learned in medical school by doing a very good, thorough history. Also, when an individual presents with allergic rhinitis, mostly caused by the pollen, which is just terrible right now, in a lot of cases, they'll have signs and symptoms that we can actually see on the telemedicine visit. For instance, I saw a patient last night, and with the telemedicine, we purchased a platform where they can look at me and I can look at them. And I noticed that underneath her eyes, it was very dark and puffy. And as I listened to her speak, her voice was very rattly, and it let me know that she did indeed have signs and symptoms which she articulated to me, and I was able to make a really good diagnosis with the telemedicine. It was like she was right here with me. So telemedicine is very promising, and I am just getting wonderful results with the patients, and it's really helping a lot of people.
Now, Dr. Quinn, how do you know when it is time, in fact, to see a doctor face-to-face?
Well, basically, when we evaluate the patients through telemedicine, we go through a list of questions. And in some cases, some of these same patients will present information to us that let us know that, hey, we need to do a little bit more. Like last week, I talked about a patient that told me that they had chest pain. In that scenario, I actually called the ambulance myself, and we got the patient to the emergency room, and it turned out patient made it, but at the same time, that patient needs to see a physician. But at least the patient is provided the opportunity to discuss what's going on with the doctor. And in the event that the patient does need immediate care to see a doctor, we're able to get them that information that they need that can be potentially life-saving.
All right, Dr. Timothy Quinn, thank you so much for joining us live via Skype today at noon. We will see you again later on this week. Have a great Thursday, Doc.
Hey, thank you, and happy birthday.
Thanks, Doctor.